In this tutorial, we're going to be talking about 3 steps on how to overcome lower back pain. What I'm going to cover are the 3 steps that I use during my coaching, be it face-to-face or online. And we're going to cover the entire journey from coming to me with back pain all the way through to reducing it and then out the other side being pain-free. Step 1 is you've got to understand your lower back pain. By just blindly going in and using core strength exercise or core stability exercises just aren't going to cut it. And it's a blanket rehabilitation that many professionals use. I get a number of inquiries that complete my initial questionnaire, and one of the questions that I asked them is, have you seen a professional before and what did they say? And very often, or more often than not, people will say, I went to see so-and-so and they told me to strengthen my core. Unfortunately, that isn't a good way of overcoming lower back pain. The first step, as I mentioned, is understanding lower back pain, and what that requires is a consultation process and some sort of physical assessment of the lower back. What we're able to do with a consultation, what I should say, the consultation that I use is sort of been templated from Dr. McGill, who's one of the renowned back pain specialists that sees a lot of people. When I went to his workshops, he was able to share with us the consultation that he uses, and I've been able to take parts of that out. I've added parts in as well to that consultation process. So what that consultation process does is it starts to highlight patterns in your lower back pain. And what those patterns begin to highlight are the triggers of the lower back pain and the parts that keep you pain free. So what we're starting to do is starting to build a picture of your lower back pain. And it's these 2 steps, so the consultation and the assessment, that is going to start to build what we do next. So just going to see someone, maybe getting an adjustment or getting a few, a bit of massage or whatever, and then them giving you an exercise program or a stretch program isn't highlighting those patterns and isn't highlighting what is triggering your pain and what is reducing your pain. Because some exercises could trigger pain. They're the ones you want to avoid. Some exercises could keep you pain-free. They're the ones you want to start doing. So what starts to happen is you start to find out from the consultation and the assessment what those exercises are and what those stretches are. What are the most effective ones and what are the least effective ones. But before we even get into exercises, we've got to look at postures, positions, movements and loads. Because again, those are going to begin to highlight what's triggering the pain and what's keeping you pain-free or reducing your pain. And what we can start doing is start using that again as a template, as a foundation to start reducing your pain and getting you out of lower back pain. So when we go through the consultation process, obviously with me, that starts in the initial questionnaire. So you go through, you fill out the initial questionnaire. If you want to do it, there'll be a link below. What then happens is that comes through to me and I start reading it. That again is just getting me started. So when it comes onto the online consultation, what I'm then able to do is obviously go through a set, I think it's 14 questions, but also based on what was said in the initial questionnaire, I can start building some other questions into that. So when we come to the initial questionnaire, I can go through those questions. Again, we can build a much more complete picture of your lower back pain. What we then ask you to do is go through and do the online assessment. So that is a number of assessments. It's all in video form. So I talk you through, it's me in the video. I talk you through all the tests, how to do them, and obviously not what to write down, but when to write it down, if it's triggering pain or not triggering pain. Once you've completed that, you can then, again, send me those results. And then once I've got the information from the consultation, which will take roughly 30 minutes to go through. Again, I've already started building a picture from the initial questionnaire. Then we do the half an hour consultation. And then you send me the results of the assessment. So I've now got a whole load of data, a whole load of information that I can now start building the next part, which is part number 2, and that is or step number 2, which is to reduce your lower back pain. As I've mentioned, some people are just given an exercise program, go and build your core strength. But again, so many people go straight into exercise. Now, with regards to the consultation and the assessment, we've just started understanding your lower back pain. Now, what generally happens at this stage is that exercise is not for the moment. That comes later. So what happens in most people is they skip this stage and they just go straight into doing exercise. So what we have to do is we have to reduce the lower back pain. So as I've mentioned throughout step 1, we are finding out information about what triggers pain, so movements, postures, positions and loads that trigger pain. We're finding those out in part 1, or in step 1. What we can start doing is we can start using that. So if sitting after 5 minutes triggers your pain, we only want you to sit for 4 minutes or 3 minutes. Then we'll need you to get up, move around, and then sit back down. Maybe you'll then be able to do that for another 4 minutes. So you've just sat down for 8 minutes pain-free. So we've got progress there. So what we've started to understand are strategies using movements, postures, positions and loads to start reducing your pain. Now, it could be for one person, sitting creates the problem. Another person, it could be standing. Another person, it could be walking. For another person, it could be all 3. For another person, it could be 2 out of the 3, and it could be any 2 of the 3. So there's no uniform way of, in some respects, giving advice, because step 1 is the most important, is understanding, because in step 2, this is where we draw the information out to be able to reduce your lower back pain. Now, once we've started reducing pain, what we can then start to do is, again, we found out what triggers the pain. What we've also done is we've found out what keeps you pain-free. So if we can start identifying movements, postures, positions and loads that keep you pain-free, again, we need to start doing more of that. Now, the important part here is the dosage of it. So how much do you do? Well, as I mentioned with the sitting, is if your pain comes on after 5 minutes, you need to get up before that happens. So that could be at 4 minutes, as I mentioned before. Now, when we get to the point of what keeps you pain-free, we need to start thinking about how we can keep doing that. Obviously, we've done one, which is sit you down for 4 minutes, but that's based on I'll get the words out in a second. That's based on what triggers your pain. Now, from the assessment, when you do one of the tests, it might trigger pain. But then we do part 2 of the same test, where we brace the abdominals, and the pain is reduced. So we know that bracing the abdominals will keep you pain-free, or at least will reduce the pain. So what we are able to do is, whilst we walk, whilst we sit, whilst we move around the house, whilst we lift, we carry, we push, we pull, whatever it might be, whatever the movement, the posture, the position or the load is, we can start to use that strategy of the abdominal brace, which will keep you pain-free. So I'm only giving just a couple of examples here and there, because what will be highlighted during that step 1 is all of this information that is specific to you, which is why I say in other tutorials that lower back pain is specific to the individual, because as I'm explaining here, I would hope that you would be able to understand that by now. So what we've started doing in part 2 is started to just reduce the pain. We've not started exercise. We might not have started stretches yet. We might have added a few in because we think they might help. But what will then happen is we would put that down as an action point to start doing. What would then happen is you would go away, you would start doing the action point. I would then follow up a few days later. How is it going? You'll give me the feedback. If we need to change anything, we will. If we need to take anything out, we will. If we need to add anything, we can. What will then happen in a couple of weeks' time, we'll come back and we'll have a second session. What we'll then do is review everything that we've done, and is it working, is it not working? We will then review that and start putting in other things in place. So it's as I've mentioned, it's a coaching process over a period of time. And in some respects, the consultation and the assessment isn't stopping. That was just our first part of it, but we continue that process on through the coaching. So then as the back pain reduces, this then now lines us up for part number 3. And that is to improve spine health. Now, this is where we can start thinking about exercise as we kind of know it today, because we may not be ready for it, because it may be causing more of a problem. Now, again, if we go from the consultation and we can start to understand that exercise is going to be necessary early on, then we would start doing it. It's just in the experience that I've had, there are some steps that we need to get in place first. And I'm not one for overwhelming someone and just throwing all of the information that they need to do at them at once. So it's much more of a drip feeding process. So we're able to go through that and overcome the pain a little bit more effectively over a period of time. But as a general rule, it's then building the spine health. So what we've now done is we've reduced the lower back pain. What we can now do is, now that we've got more space being pain-free or more time being pain-free, we can start adding in core strengthening, core stability type exercises. But as I've mentioned all the way through, that will be highlighted from step 1, because within the assessment there are some core strength and some core stability assessments. So you complete those. Again, if the scores are not so good, we would then want to start putting that in place. So you may experience poor core strength scores, but really good core stability scores. So again, we would focus on core strengthening, or it may be vice versa. You may have really good core strength scores, but really poor core stability ones. So we would focus more on the core stability side of it. You may have poor on both, so we need to do both. You may have really good, so we can start it a bit earlier, so on and so forth. So you can start to see that within these 3 steps, your journey is mapped out because of the consultation, because of the assessment, and also the feedback that goes on throughout. So hopefully by now you've started to understand that just being given a couple of core strength exercises or some stretches by someone who's giving you a treatment and minimal consultation and assessment is not going to be that effective, because what I'm hoping you've understood is that there's a big pool of information that needs to be gathered first, and then there are steps that you can be doing every day with your everyday movements that will help reduce your pain anyway. So everything may happen before you even get to exercise, so you don't even need exercise to overcome your lower back pain. All you need is the correct movements, postures, positions and loads, and that's absolutely fine if that's what's needed, because it's not about the exercises and the stretches that are going to get you there. It's about using your body correctly, and if that means using exercises to use your body correctly, then that's a part of it, if that makes sense. So hopefully this has given you a better idea of how you overcome lower back pain and the 3 steps that I use, and a little bit of content with regards to what goes into those 3 steps. So it's, again, you're not just blindly coming into a 3-step process without knowing what's going to be happening. Again, as I mentioned earlier, if you want to complete the initial questionnaire, you can click the link below and you can go through, enter your details, and you can do that. What will happen is, once it's completed, within 24 hours, I'll be in contact to ask whether you'd like to book the initial consultation, and then it can be we can then go into the assessment as well, and we can then get you on the road and get you on the journey to becoming pain-free. So many thanks for watching. My name is Chris from Chris Pole Training. I'll speak to you in the next tutorial.